No, this is
Oh.
just standing.
Good afternoon. This is the House Appropriations Committee. It's Monday, March 9th, 2026. It's about 5 minutes of 3 or a little less than that or more than that or something. And we have a joint fiscal office and James with us to talk about the latest iteration of a spreadsheet. This is all still in draft form. It's not being posted on our committee page. But we're going to see what we've got now. So James, welcome.
For the record, James Duffy, Joint Fiscal. You all have copies of my comically oversized prop table in your inboxes as well, if you prefer a virtual format.
It's really nice to have the big print.
Yes, understood. So before town meeting week, you'll all recall that we reviewed this spreadsheet, which I have refrained from printing out the updated version of the master spreadsheet for you all today, only because this information will continue to change. I don't know what the committee's appetite is for how many of these this size tables you all would like, but for now you have a copy.
At one point, we'll have one that
Yes,
has
exactly.
everything on it,
Yeah.
that maybe 10 pages long.
Yes, so for today, you have the update that contains the committee letter recommendations above the governor's recommended budget. But eventually these will all be consolidated as you all continue to receive bills with appropriations in them as well as we approach crossover. So before town meeting, we discussed 3 buckets of over-gov requests that you all will be considering. Requests from departments and agencies, those from advocates, and those from your fellow legislators. Today, I have in front of you a preliminary table for the 4th bucket, which is recommendations from your standing policy committees. And then the 5th and final will be the bills that will, like, as I said, be coming your way over the coming days and weeks.
So just a reminder, what we got before we went on break was worth 194 million and change.
Yes. What you have in front of you today represents a tentative unduplicated total of 10.7. I will put a major caveat on that, though. I am still in the process of reviewing the House Human Services Committee letter, which will, I think you all anticipate, add to that total. Transportation is, their committee letter primarily deals with state revenues. I don't anticipate that will add any additional appropriations. And House Ways and Means contains 2 small appropriations and is mostly revenue related otherwise, but still reviewing those. So they are not yet reflected in the spreadsheet.
It will go up by a bit.
By a bit. Well, yeah, I think HHS will certainly up the total and still digging in there. But so for today, we're at a preliminary total of above GovRec requests of 213.5.
So we haven't hit 300 million yet.
No, we haven't actually. The committee members went relatively easy on you all. Actually, there are a lot of, and we'll go into this as we talk about the formatting of what you have in front of you. But what you have in front of you represents a lot of individual discrete requests, but many of these are duplicates of requests above the governor's recommended budget, which you have all already heard either through advocate requests during the public hearings, from your fellow legislators, or during budget testimony from departments and agencies. There's really, I mean, the rhyme or reason behind what counts as like the original request and what counts as the duplicate is just the order in which the information was received, at least at this point in time. But as of today, we're at about $213.5 million in terms of above GovRec general fund requests.
And we still have no idea if we'll even have $10 million in money to offset the 213 million. We're still working on that part of it. Some of it, as you've all heard, we find little bits here and there, and we're still working on where we can find other stuff that isn't general fund.
So that being said,
how do we read this?
yes, let's talk about the table in front of you all today, which is the committee letter recommendation. So I apologize, first and foremost, that the gray, many of these cells are grayed out, which is not high enough contrast that you can easily distinguish in the printed format, but you can see a bit more easily on the screen in front of you. Grayed out cells represent duplicated requests that are already reflected in what we discussed the week before time meeting, advocates, department and agency requests, et cetera. And then cells that aren't grayed out are unduplicated requests that represent new budget requests. And so those are the requests that sum to the 10.7 million that you see at the bottom of this page.
So, for example, I'm looking in the House Ad. Did Salvation Farms come up during one of the public hearings? I just don't. This is the first place I remember hearing about it. So it's a The others I get, but I wasn't sure about that one.
Salvation may have been written testimony. Yes, Salvation Farms was received as written testimony through the
Okay.
public hearings, and the original request was actually for $100,000 on the written testimony. But as the committee letter recommended 50,
Just went.
encompassed within the larger number.
Okay, thank you.
And you'll see that with a number of the public hearing requests. We received about 40, I think, written pieces of testimony that weren't accompanied by oral testimony. So if you see something that sounds unfamiliar to you in those columns, there's a good chance it was in written testimony, but feel free to follow up with me or JFO to confirm. So that is the first kind of legibility note. The second is similar to the spreadsheet we reviewed before town meeting week. You'll notice there are cells that are highlighted in yellow. These represent potential global commitment eligible items. And Nolan and I have been talking about the best way to represent for global commitment what the general fund global commitment split is, right? Because some of these, the split may be 50-50, it may be the standard FY27 FMAP. Given the number of global commitment requests that are in the mix and sort of infeasibility from a workload standpoint of JFO and AHS verifying each of those global commitment requests individually, we're considering the potential best way forward being committee members. You will all vote at some point on what your priorities are for requests above GovRec, right? I believe that's part of Madam Chair's plans for you all. So you'll go
Have you vote,
ranking-
it'll be an indication.
a ranking
of what priorities
exercise,
are.
yes, a ranking exercise to kind of vote on what your priorities are. And for those global commitment items that rise to the top of that priority list, from there, that would make the most sense for JFO to then work with AHS on finalizing and confirming the global commitment split. Where available, the global commitment general fund split is identified in these, in the tables that you're receiving for this. But final JFO verification will likely come after you all vote on your priorities or go through your prioritization exercise rather.
We don't want to make extra work for everybody if we're not even interested in pursuing that particular thing.
And some of these items, it's, given that they touch multiple AHS funding streams, it's a substantial amount of work for AHS as well to verify.
Those you guys, right? We don't want to do make work. Tip has a question, then I have a question.
Yeah, there are some that might be eligible for, might be eligible for rural health transformation, right? And we'll have a conversation tomorrow, I guess. I don't know how specific we can.
Well, the thing is that we will see how the rural health transformation would enhance what's happening. It's not that we don't replace or any of that stuff. We are just looking to see how it might fit with other programs that we're doing or whatever. So we have to be very careful how we do all that.
Yeah, and I'm assuming you didn't, these aren't just the highest priorities, right? These are all of the.
These are all,
commitments that-
yes.
That's for.
Yes, and the committees, these are listed in the order in which they're presented by the committees. So in general, if you're looking within the subset of recommendations from House Agriculture, for example, or from House Education, these are in general listed in order of priority, but the final iteration of this will have more specific notation that shows the top tier, middle tier, lowest tier prioritization that was given to you from the committees.
So my question is, and then I'll go to Tom. In line 10, House Commerce opposes the reversions.
Yes.
So wouldn't that be money coming back? Isn't that like an ask? And so shouldn't that be a number?
So this one is, I'm digging into this one a bit more because they are opposing reversions, right? So the governor recommended reverting funds.
Right.
Which presumably means that increased the amount of general fund available in the governor's recommended budget.
Right.
But if that money was then rededicated to other purposes, you all would have to, have a corresponding cut to those other reallocations of those funds in order to then use those funds. So
So to me, that's an ask.
yes,
Does that make sense?
And then this isn't a zero. Really what this is, you know, I think this would be a negative number, right? This is proposing to free up money in the general fund, but it's a question of
Well, they want to keep
what
the program.
purposes, right? Then
So they're asking for the program. So to me, that's an ask. So I don't know if that doesn't make sense to people, or does that make sense? Go ahead, Tom.
Yeah, I think what makes it hard is that we're always told that if I take money away from one thing and throw it into the general fund, it's just caught in the stream and doesn't matter. I can't go back and say, well, we're using that money specifically for something else. That's a theory. I mean, I can say, I want to cut $1 million from a program and then rededicate that money to something, but it's not really, once you take the money away from it, it just goes into the stream. And we notice the stream's a little higher and we pull the money out. So it's not a direct, that's what I've learned over the years. Like, we can't say I'm taking the $1 million for this and putting it for that. And that's what this sounds like. They've taken that, they want to take that money away.
They want to put the money back. So the governor has cut those programs.
Right, but the governor took the money away.
Right, and spent it wherever he spent it.
Right, so it doesn't matter.
I don't know where, I don't,
yes, I'm sure I do believe you're correct. That these are opposing the reversions and proposing that they be
right.
continue to be used for
Right.
those.
So it means if we want to do that, we have to find the money somewhere.
Yes.
So I
Which
would,
is true of always.
But that's true of, yeah.
yeah, so but that's why I put it in here.
Yeah.
So I would add those in.
Yes.
And those might be 3 different things. Sorry, I just made more work for you.
Were those all reversion?
They were
Yes.
3 reversions.
Okay.
So I would put them on 3 lots.
Are we really talking about this? You know, when the governor does a budget, the agencies are asked to provide their budget. Then there may be reversions within state agencies, so money goes back in. But here we have a committee that's asking for money to be taken out. Is the proper term a reversion?
It was a reversion. Yes,
Or is it a reversion? Is it a reversion in the governor's budget?
the governor
Yes.
reverted the money
Yes.
Okay.
And they oppose it,
and they opposed the governor reverting the money.
so they won't spend
I was
it.
thinking they were proposing to revert some of this.
No. No. So if we take money out of the carry forward, right, we're gonna revert. I think that's a reversion if we take money out of the carry forward.
Sure.
Reappropriating.
And then we reappropriate.
Carry
Right.
forward funds, yes.
So on a specific question that I had, line 19, which is the commerce letter, to increase down tax credits, but that's whether or not that $3 million is part of the conversation, that's up to Ways and Means.
They can recommend it. Well,
That's nothing we do,
yeah, it's a decreased general fund if they increase the tax
but
credits.
they are, Ways and Means has to recommend the tax credits, or can we just say, here, it's $3 million, we, increase the tax credits?
I don't know what the Ways and Means letter says, whether it talked about it at all. Let me find my Ways and Means letter.
My JFO colleague in revenue team is indicating that the House Ways and Means letter does not include this increase, not appropriation, but an increase to the downtown tax credits.
Okay. Right, so when we make a decision, we could say, well, commerce, I could understand why that's commerce and economic development, and that's economic development to be doing that. Ways and Means we would say, just as you did, Tom, does Ways and Means support this?
Right.
And they're not supporting it. So that might influence whether we think that's one of our top priorities if we have a few $1 million to spend.
Well, they're not specifically supporting it, whether it was an option that they looked at, we don't know.
Well,
I mean,
I think the
it's
chair,
a-
the chair handed us out to the other chairs, I think, tax credits that we can look at.
Okay.
So I haven't, I think that was the end of last week. So we have been talking about tax credits and whether it makes sense or not to do so. But we could also say, if we think this is a good idea, or even if we don't, we could go talk to Ways and Means.
Yeah, I think we
And
would
say,
want to
like,
consult with
Right,
them.
right, and say,
What do they think?
they put this in and what do you think? So I'm kind of looking at like, since it's tax. Okay, Wayne, did you have a question?
different topic, but,
Yeah.
do we have a GovOps letter?
Yes, we do. The GovOps letter,
On a huge spreadsheet.
Because I'm curious about the veterans home thing that they put in there. Where'd that come from? 49, 949.
yeah. The $337,000 for the additional Vermont Veterans Home funding was a base recommendation, increased base recommendation from the House GovOps committee letter. I don't believe we received testimony from the Veterans Home requesting additional funds. So some additional homework for me to do, to see where that originated. And if
I
that's,
can also help you with that.
Yeah.
It's yours.
okay.
That's mine. So, I mean, that doesn't.
I don't remember that the auditor came in asking for money
No,
either.
No, he did not.
So this looks like the HGO listing here. It seems like these are the non-duplicative. They had several pages on their chart of things that were duplicative. Is that right?
And these were interesting to me because 2 of their 3 requests do pertain to, governmental offices, agencies, but these were not requests that we heard from those entities about during their budget testimonies. So the auditor did not request additional funds from you all during his budget testimony. Similarly, the Veterans Home did not include an above.
Very specific number too, down to the dollar.
Right.
It was the BAA, we had, of course, BAA with the Medicaid reimbursement stuff that comes in, that's always going to come in. And I don't know if this is an attempt. It seems like I'd have to go back and look, but it seems like this is in the ballpark of the amount of money.
Yep, their committee letter here.
So do you have their spreadsheet?
I do. I'm going to share it with you all now.
Yeah, the Vermont Veterans Home, I did read all these last week. And I wrote under that one, gap. The gap is not in the governor's recommend.
Gap.
There's a gap.
That's a name of something.
Huh?
I'm sure that's probably an acronym.
No, it's a gap in funding, I think is,
Not generally counted. Except in.
yeah, no, it's not gap with 2 A's. Generally
I see
accepted
it
county
now.
principles. Gap is not in gov recommend. It included a normal inflationary increase to help offset higher costs for staffing and operations.
We didn't hear anything about that.
No,
I'll ask. I'll start with GovOps.
yeah. Because that seems like a brand new request from a committee. Maybe they heard something, but I don't know why the Veterans Home wouldn't have told us if they.
Right.
That's sort of
And
unusual.
I'll circle back around to it.
Yeah, you could check on that. But they had a lot of stuff on their spreadsheet. Much of which was the governor's recommend, but it looked like there was some. I know you're still working on this, one, James, right? The GovOps one?
No, GovOps,
It's
no.
No, so Secretary of State, you're not putting down the stuff in there. It's already somewhere else.
There were a number of
Yeah,
duplicated requests in the GovOps letter specifically, just for the sake of space. I left them off the spreadsheet for today, but for clarity going forward, all the duplicated requests will all be reflected in here. But in front of you today is just the unduplicated
Yeah.
GovOps committee
Okay.
recommendations.
and the auditor thing was a surprise too, when I saw that. I'm trying to figure out where that was in that. Trevor?
Yeah, James, I'm only seeing one item here for House Judiciary.
Yes, the other items in their committee letter were
Yeah.
were duplicates of prior requests. I believe so. Judiciary.
Right, who was the auditor? That's you, right? Would you check on that? Because there's no information. If I didn't get.
Says BFM. Financial management.
Department of Finance and Management? I have no idea. Anyway, Michael checked that. Hold on.
130.
Very strange.
It's represented, in my reading of that letter, those are all requests that are reflected in previous requests, either from government agencies like state sheriffs and attorneys, judiciary, or requests that we've received from outside entities such as legal aid.
I'll have to double check.
Sure, yeah.
I wonder if some of their other stuff is in other bills instead of in
Well,
their.
it's in other areas, I
letter?
understand that, but yeah, I'll double check.
So yes, that would be what you're doing is good. So all of you should sort of check these against your portfolio and your committee letters to see if there's some things.
An additional item that I wanted to highlight for the committee, only because it's been raised in several of the kind of buckets of additional funding that have been presented to you all so far, and various funding sources have been proposed for it, has been these VSAC forgivable loan programs, right? So VSAC administers a number of forgivable loans program with funding through the Department of Health. These are for nurses, for mental health professionals, other medical professionals. And I believe the FY 27 governor's recommend proposes removing funding for all varieties of professional forgivable loans.
Yeah.
VSAC specifically has requested additional funding through global commitment dollars for the nursing forgivable loan program. You have heard from other folks who are requesting that all those professional forgivable loan programs be
Come back.
come back. So that is potential global commitment, and it's one of the larger kind of outstanding items. And then the other VSAC item is these freedom and
Unity.
scholarships.
Right.
At this point, we have heard requests from folks that suggest using general fund dollars. There's also a request in one or two committee letters suggesting that these be funded through the higher ed trust fund, perhaps in lieu of the $15 million multi-purpose center.
This is scholarships and that's for scholarships. So there's actually a reason to do it from there.
Right, so just wanted to highlight those.
And do we know, do the Freedom and Unity scholarships only go to Vermont State colleges?
I don't know the answer to that. I don't know if it's VSC or UVM or both.
Two people that would know. I think they might, but go ahead.
So were there any of those forgivable loans through the Department of Labor?
I don't believe so. I think they all run through the Department of Health. They're administered by VSAC with funding through DOH.
There were some other things that were Department of Labor. There were some suggestions to not, I think that was in House Commerce, to not revert some things from Department of Labor or revert it to use for.
Yes, you all have received some committee recommendations for specific reversions as funding sources for some of these.
Yes.
recommendations.
Yeah.
And so those sources have already been taken, correct? Or
I
not?
can't speak to all of them. I think broadly speaking, they have probably, unless somebody has been digging through the carry forward reports on your policy committees and looking for other carry forward funds for reversion. But I believe all the highlighted reversions have been
Yeah,
incorporated into the FY 27 gov rec.
right, in the governor's budget. So it's the other ones that are left that we're looking at.
Also, I can confirm, thanks Chris Roop, that the Freeman Unity scholarships are just through Vermont State colleges,
Okay.
not through UVM.
Okay. Are there any, you're next, are there any of these loan programs that would go to UVM? I'm trying to think about balance. If we take some money out of the higher ed trust fund, you know, the scholarships are usually done at a similar rate to each of the entities. And if we decide we want to do some freedom and unity, I'm wondering, is there some other kind of thing we can do for UVM? Are there other forgivable loan programs that are at UVM? I don't think we're the ones that have the answer to that right here, but that's sort of what I'm thinking about. To make that kind of even.
Yeah, it sounds like we have clarity that the Freedman Unity are just Vermont State colleges. As for the medical professional forgivable loans, that would be a question for VSAC or DOH as to what institutions, what are the participating institutions?
Okay. Good.
One comment, I don't know if this matters, but there's a difference between, say, addressing a reversion or restoring a cut. Is there a difference? Is there, in terms of like how we note these things so that maybe there's not?
I don't think, I think from a
Okay.
money standpoint, it's, we want something back that got taken away.
Okay.
Are you referring to like in the AHS budget where they outlined all these things where they
They were just gonna
reduced-
cut.
those
Yeah.
were cuts of, that
Right.
they were recommending,
Right.
to just not spend.
Right, right. And a reversion, you know,
Versions from a list.
yeah. I mean, this is from a list of programs, but it's, I mean, I think that I'm just trying to work it out in my head. Is it even important to note? And probably not. It's just that, you know, in my, here's where I'm coming from, is that in my own mind, something that's listed out as a request is different to me from, I mean, like a new request, like a new program, than restoring a cut for a program that has existed, for which there may
So we
be
need another
a
color.
constituency.
No, seriously, right.
I mean,
So we've got these three
I'm not saying one
commas.
is more, you know, it ranks more important in my head, but it is just kind of, it feels a little bit different, than playing
Right,
with.
so maybe we
reverse,
just
you
put
know.
that in pale pink, or, you know, I don't know.
Single out requests that are the, you know, the
Or they want
reversal
to-
of a cut, or to
Yes,
your point as
exactly.
well,
Exactly.
reversing a reversion.
Yeah.
Right,
See, frequently what happens when you gotta, say you've got money that was appropriated to a state agency, and it's sat there for 3 or 4 or 5 years.
right.
Then it gets pulled back, it's reverted.
Right.
It's brought back as a reversion,
Or not,
or not, it stay there as carry forward,
right,
right? But when it's taken back, it's called a reversion, so.
Yeah.
I mean, if we're.
that's right.
Technically, we want to make sure we don't confuse the things that.
But it's reverted to the general fund.
Exactly.
And then there's the second piece, if I'm getting what Emily's taught me correctly. It's a two-step process. You revert it to the general fund, and then you appropriate it from the general fund to whatever you want to appropriate for. But it goes into the big pot. But if we want to, and I agree, there's some things that we've talked about, House Commerce would like to restore. We heard from the 28 legislators in Chittenden County about restoring the 160,000 for the
community outreach.
Community outreach mental health program, which is not the same as the mobile crisis. So that would be restoring a project that was cut. These are restoring of projects that were
Yeah.
cut. So I think we should put them in
Right.
as money that could possibly be spent, their requests. But maybe if there's a restoration, we can just have it a slightly different color from the other the other things. I don't know if that'll work or not, but so people understand, so we look at it differently. I mean, we don't have to look at it differently, but we know that it's trying, that's where it's coming from. Emily?
Throw one thing out there, just for your consideration, Emily Byrne from the Joint Fiscal Office. Sometimes with the reversions of these types of things, it's also important to look at the context for which those monies were appropriated. So if, say, 3 years ago, there was a significant amount of extra general fund and some significantly sized one-time general fund appropriations were made because there was a lot of extra general fund revenue, and it was either at the time meant to be time limited, right? Or at the time was meant to be use it until it runs out or until like
Right.
there was a lot of assumptions made at the time about demand for programs, the need for programs, and a lot of money got appropriated a couple of years ago. I think making sure that you look back at what was the, is it a cut to a program that has existed for 2 years and there just happened to not be demand for that program? Is it still highest and best use versus is it something that's existed in the base budget for a longer period of time, right? Like, I think it's important, especially with the reversions, because I think some of them are reversions of programs that went into effect with one-time money.
Right.
For the purposes, because of the amount of one-time money there was, and
Yes.
if you want to continue them until the one-time money is gone, right?
Right.
Is there a better use of the one-time money, and just the sort of is it really a cut to something that just a little bit more context around what does that mean in terms of pulling back something that's been in existence. I think it's just an important conversation.
Absolutely.
Yes. Yeah. So we have to dig into some of those things.
Well, that is our,
That's our
that is
job.
our job,
That's our
right?
job. We do a lot of digging.
So that being said, this will be fleshed out with both the duplicated requests, so you all can have the bird's eye view of unduplicated and duplicated requests. So for example, Representative Morwicki, there will be additional GovOps items to reflect duplicated requests on the final version of this. And then you all will be hearing bills over this week and next as we go through crossover. So my intention is to have these buckets finalized for you all as soon as we can this week, and then the bills will just be added to, on case by case basis as we hear them individually, so that this is ready for your prioritization exercise.
And my job is going to be working with these guys to try to figure out what is the pool of money that we can spend on these $250 million of requests, yes. So, I mean, James and others have been doing great work trying to get to, we went through all the carry forward sheets, and we're trying to get information on that. And of course, nobody wants to give up the carry forward. But so that's where knowing the context of whether we can take some of it or not, it becomes helpful. So we're digging into some of that. We have found some, it sounds like, and we have other special funds that some things, and when I'm talking about are small things, we aren't talking about multi-million-dollar pulling out, like the emissions repairs, a few $100,000, but may cover a couple of key priorities. But we mostly aren't going to find some pot of $10 million lying under the table that nobody happened to notice. Maybe, but I'm not counting on it. These guys are doing great work trying to dig all that up. And the other thing is that whatever we find, when we scoop it up, it's one-time money. And then what the heck are we going to do next year? Okay. So if we scoop $5 million from XYZ thing, it's not going to be there next year. So we know we're going to use one time for one time. And how much, and do we scoop and somehow reserve some of it for the next year? Do we, then does the Senate take it all if we scoop it? And, that's the other thing. And so, so those are the other parts that I'm wrestling with on the, where can we find the money part of things? So, Dave?
There may be some possibilities of building a bridge to something now. The so-called healthcare program, the AHEAD program was delayed and pushed off to 28. But to me, it would be a reasonable discussion to say, do we believe that? And if so, is it less costly to Vermont to have a bridge to it or nothing?
That's right.
And then if you want it, you gotta rebuild it.
Right. And so that's another,
Cost more.
that's going to be another question. Without
It's
it.
one that I'll be
You'll be thinking about,
considering.
sure. Yes. Go ahead.
And it sounds, this process, regardless of where we are in the world, is like this every year, where it's just sort of, for me, I'm focusing it for myself, just like, who needs the most help? And can we provide it when the rest of the world is the way that it's been for the last year and change? Like the way that, I mean, we know that there's certain things that we don't have a lot of say over, ADS being the whipping boy, so far. But the idea of our decisions being, I mean, there's always a worry of how is it going to be next year? Because we don't know. I mean, if Tom Cavett comes in July and says, we're down 15%, then you have all of 6 months to prepare for what that means, and it's just, but I mean, I'm not dismissing worrying about what's next year, but it's just that feeling of like, do you feed people or do you pave the roads,
Right, so there's this need to think about the immediate issues. And I also can't help but think a little bit further and say, what is that gonna mean for next year? I think we have to do both.
Sure. Yeah.
And I don't know what that looks like. So I'm just sort of sharing my thinking about stuff right now.
Plus, we get to express what we think it is.
Yeah,
And we're not going to control what the Senate thinks.
no,
But if we don't put it down on, if we don't put our side down on paper,
right,
then we can't talk about it in May.
that's right.
And no matter what the governor thinks, like
Yeah.
we have to decide for ourselves what, starting with
That's
this
right.
committee, what is important, and then.
Exactly. I'm trying to find the thing in, in the review, yes, economic risk matrix. I'm just trying to see if war is in there as one of them. Because, we got this in January, so I just have to tell you, Friday is March 13th, and it was March 13th, 2020, we closed down our government.
Sure.
And we thought we'd be gone for 2 weeks. Remember that? And we passed all those
Yeah.
bills, it was Friday the 13th, and now we're back to Friday the 30th. And we had gotten this matrix, and a global pandemic was not on the list. It's now in there, so I'm just checking to see if a war is in there, whether you put that in there. for
See if
anything.
Cuba's on that list.
Cuba is not, Greenland is not.
Venezuela.
No, we've got US-China tensions increase, we have Russia-Ukraine war escalates, we have nothing about Iran, oil prices spike, but that's not enough. I don't know.
Global trade war.
Yeah, so, yeah. And there's this CRE doom loop, what did you have? Did we miss anything?
Alien invasion.
Alien invasion.
Yeah, we need to think about that one.
Full news.
It's the CRE doom loop that cracks me up, and that stands as commercial real estate doom loop.
Oh.
It's not high on the list.
We'll be able to buy houses in, right?
Well, no, because you won't have any. The private equity companies will be able to buy over.
Go ahead, Tiff.
Oh, I've been thinking about this a lot,
Yeah.
over this last week, because I think that there really aren't, kind of like, ooh, we'd really love to's in this. This is kind of basic. Most of these requests are pretty basic. And I've been thinking about, I've been counseling myself that I can't be married to the things that, are in the budgets I have. And, I really am trying to think, okay, what's the big view that I need to take? And, I'm struggling with, there are some things that are immediate needs, right? That we know about that, and we have to weigh the costs of putting money into them now versus picking up the pieces later, right? There are the strategic kind of investments that we've been asked to make in certain places. VHIP, is one of them, right? And then there are kind of insurances, like the farm fund, I guess. And what I've wondered is whether, how much of what we recommend should address just basic needs. We just got to tread water here. And where might we want to invest money? It would be smart to have invested. We will be glad we will have invested, years hence. And I don't have any answers to this, but it's just trying to think about, I could fund pretty much everything on this list, I think that people have made very good case for them. And it's going to be excruciating to have to choose, given the money we're likely to have. And I'm just trying to counsel myself about how to think about these things and keep myself from being an advocate For, because the world I know is the human services world, it's what I've done in my life. And so I'm particularly sensitive to those things, but I also know that primary care is critical. Like, and my own doctor emailed me, over the break, about the need that you were talking about, Dave, about the head model anyway, it's just going to be an interesting, heartbreaking, exhausting process, I think, as I look ahead to the next 2 weeks. And the bills, when we think ahead about the bills and the money that's in those,
I don't know how much money is in all the bills. I feel like the committee chairs have heard me talk. That doesn't mean there's no money, but I think we're not gonna suddenly get a $10 million request out of the blue from, I could be wrong, but that's not where I think most of them are going, because they've been canceled about that.
Wouldn't they have put their main priorities in their letter?
Yeah.
Makes sense.
But we all have to sort through and think about this. I mean, that's our job, is to figure out how we're gonna do this, because we won't have 10% of what's needed, of what's being requested. We will not have 10% of it. I hope we'll have 5% of it. That's a lot. That means 95% of the things we're gonna be saying no to. Unless we can pull more rabbits out of our hat, but I feel like we're running out of rabbits. And seat cushions. Yeah,
Right,
yeah, cushions. So you're right. It's gonna be hard. We knew this was gonna be hard, and here we are.
I don't know. I don't know why I just felt the need to kind of share what's going on in my head, because maybe somebody else had another way of viewing this. But it's I guess I'm really wrestling with what are the longer term investments that we may want to make at sacrificing some of this, the other things that we really care about. I confess that I'm very suspicious of big round numbers. And, I don't trust them. And, we have, someone asking for, they've been level funded for 4 years. We rely on their services, in this building a lot, and they only need $160,000. Are we going to say no? Well, that might have a real cost.
Well, maybe the 4 million isn't really 4 million.
Yes, maybe exactly
860,000.
3.2 million.
Right.
And that's what I've been trying to get at with conversations.
Our thing's been rounded, and if we got
Yes.
rid of some of the rounding, because I imagine everybody likes to think
And
that,
can we
just in
just
case,
say-
right? So maybe if we shaved a little bit off here and a little bit off there, we'd end up with a little bit more to help some of the things.
as long as you don't shade it so far that it's. totally
Right, not useless,
Yeah.
right, but maybe there's 50,000 from this one and.
Who do you think
20,000.
rounds down?
Huh?
Who do you think rounds down?
Okay, nobody.
I agree.
The nonprofits. I think a lot of the nonprofits round down.
Some might.
And I just know from my own experience, I would come here and I knew that I was reviewed as someone with hat in hand, right? I was not seen as Vermont Works for Women was not seen as value added. We were a drain, a siphon on the system, at least in some circles. And so, and I think that nonprofits, many of them, ask for as little as they can, because they know things are tight. Things are tight where they are, so they understand things are tight, and they just need that thing. And so that's where I get really torn, because I feel like some of these smaller asks are critical to survival for some of these organizations. And if we didn't have, say, a Vermont legal aid, well, there's a huge hole then in legal representation in the state. There's just nobody to replace it. There's no other healthcare advocate to send people to. I can't tell you, 15 times a year, I'm sending somebody to Mike or somebody on his staff to deal with the healthcare health insurance issue. I'm talking too much, but it's just, it's the big round numbers that stop me. And I'm not sure we're gonna know enough to know, well, how do we?
You have some insight on that, Wade?
Well, you know why, you get an idea why I was cranky when I got here this morning, because I've been thinking about all this stuff and researching stuff for the last week.
Yeah,
Well, guess what? And I'm with you, and you're exactly right. You don't see me advocating for things very much, and there are places where, you know, my heart lies, where I would advocate, but I don't advocate that much. I'm looking at operational. I mean, if you're running a business, you got fixed costs and you get discretionary costs. The fixed costs keep the lights on, keeps the business working. You have to have the core. We have to have police force. We have to have a lot of basic things that we have to fund. I mean, just 250, 300,000 for this study for this dam safety, where the dams might, if it disappears and 10,000 people get killed. Well,
It's kind of worth spending some
that's
money.
kind of, you know, something we need to do. And you're right on a lot of the little things. I mean, some of these big things are such big amounts and they're, you know, 0.0000, there's no pennies involved, but then somebody else comes in and it's down to the 11 cents, right?
Right.
Yeah.
Well, obviously the one that goes down to 11 cents, somebody's actually worked on a budget. And the one with, you know, 5 million, it's just and some of them will make pie in the sky requests.
Yeah.
So the only way we know what they really need is looking at the past history, maybe, you know, asking a little more detailed questions exactly what they do.
Yeah.
But in those big amounts, there's probably a lot of little things, a lot that could fund all these little things. If you can find the right places. But we gotta be careful that we don't shortchange the things we need to keep the wheels on the bus.
Right, yeah. It's a tricky balance that we have.
I tend to think that a lot of the smaller things can be, especially in the social services area. And I think there's a possibility of those being funded locally. At least I think in my area, you know, if there's less fund made available for the food show and those kinds of things, people come to help and people donate to that locally. So that if you see a concern in your own particular area, either for helping support medical care or food safety or a variety of other things, in small amounts, I mean, I'm talking about $100,000 or less, you tend to get fundraising at a local level if the local community sees it as an extreme, a need that they need to have funds. So state government doesn't need to do everything. But we do need to do a lot of things, certainly, you know, in the police department and the transportation and basic human services. Yes, we need to take care of those. But I think a lot of the smaller things that people come to us for, they're all laudable. They're wonderful if we had the money for all. But I think we have to think about what either the local economy or the local philanthropic community will help cover some of those things.
Well, and what are the core functions of government, which
Right,
is
we need
a
to
whole
remember
other
what is
conversation.
that? Right. What is our
What
obligation?
and that we may get a variety of answers around the table if we were to list them all out, but we are at that place where we really have to say what are the core functions, what really has to happen, because we are not, I mean, most of us have been here, some of us have been here before COVID, when we didn't have all the federal money and there was still. But the difference when we had gaps before was that we had the federal government working with us. And we don't have the federal government working with us now as much. And so it's a very different place. It's a place that none of us have been in, even if we were here in 2009 during the recession. It's just a very different place right now.
But everybody should appreciate that, you know, you can grow and grow and grow and grow, but there always should come a time when you,
Limits to growth.
and have to go backwards some, because there's always things that aren't necessary or that fatted up too much that need to be slimmed down.
Yeah.
It's good exercise, and it's good exercise for us to think about it.
And that individuals can think about, as
Yeah.
opposed to depending on the government.
Well, we also, as a committee, don't have the capacity to dig into every single thing. Right, and so the policy committees are doing that to some extent, but even they can't get into every single thing. And that's why some of you, like Dave, who's had all this experience in human services, you know where to look for things and how to think about things in ways that I will never have because you've been there. And this is why we've tried to have, and there may still be a bill coming out of GovOps about government accountability and actually really focusing on, do we know, where's the fact, right? And are we getting the outcomes that we think we ought to be getting for spending taxpayer money on these programs?
Yeah.
So there's a reason to have those kinds of projects happening.
That was part of my thinking over the weekend, was bothered me, is accountability. I'm talking to Tiff and I had a discussion today about, what's the data you're collecting? What statistics are you using? If you're doing something, are you doing it a priori where you're deciding on the methods you're going to use before you start collecting the data? Or you're taking data that has been collected haphazardly and trying to apply statistics to it? Now, how do we figure out what's working, what's not working? And when we spend money on it, how much good we got out of the money, how much return on our investment we got, right?
It's a lot to think about, and we as a committee are not going to solve it all in the next 2 weeks. But we will do our best. So we will thank you all for listening as we have this conversation. At least you have a sense, JF, of what we're thinking all about. Appreciate the latest iteration, James. This is hugely helpful. And we may pop you back into the schedule tomorrow if we have updates. This week is going to be fluid. We're going to be, bills are going to come. We'll have time for you guys to start working. You can start thinking about your own priorities with the spreadsheets that you have so far. We aren't at that place yet where we say, what do you want to take from and where do you want to give? But we at least can start thinking about, within what you know so far, what are the key things for you, and are there places you think you can find the money that aren't general fund. So there's plenty to do and think about. Yeah. So 10 o'clock tomorrow morning, we have Jill with the Rural Health Transformation Grant report. We have some more bills tomorrow too. Oh, and President Trump from UVM is going to join us by Zoom. I wanted to give her a fair shake and talk about the $15 million. Because we've heard from everybody but her, and I feel that we ought to at least give her a chance to explain what her thinking is on that as well. So that's it. If there's other things you think of for people we need to have